Welcome to the clinical training on infection prevention and control at MedElite. As on-site healthcare professionals, you're entrusted with the health and safety of our patients. This module will guide you on the core infection control practices you're expected to implement during every patient encounter.
Hand hygiene, your first line of defense. Washing your hands remains the most effective infection prevention measure to stop the spread of germs. Make sure to clean your hands thoroughly in all the following situations: before and after any physical interaction with a patient, before and after touching medical equipment or electronic devices, after contact with bodily fluids, excretions, mucous membranes, or contaminated surfaces, even if gloves were worn, before performing invasive or sterile procedures, after removing gloves or using the restroom. To ensure cleanliness, you can use alcohol-based rubs if your hands are not visibly soiled. For visibly dirty hands or after caring for patients with C. diff or norovirus, you must wash your hands with soap and warm water thoroughly for a minimum of 20 seconds. Remember, gloves are not a substitute for proper hand hygiene.
Standard precautions, additional steps. Along with hand hygiene, these standard precautions are to be applied regardless of suspected or confirmed infection status. Wear gloves when in contact with blood, body fluids, secretions, excretions, mucous membranes, or non-intact skin is anticipated. Wear a gown if clothing might be contaminated by body fluids. Wear a mask and eye protection during procedures that are likely to cause splashes or sprays. For example, suctioning or wound irrigation. If you feel a cough coming, cover your mouth with a tissue and dispose immediately. If you do not have a tissue at the time, cough into your elbow. These standard precautions protect both you and the patient and are non-negotiable in every applicable clinical interaction.
Transmission-based precautions, important measures. Some patients require specific isolation precautions based on the mode of transmission of their infection. Before entering a patient room, always check signage outside their door and refer to the community's infection control plan. Contact precautions for MDROs like MRSA, VRE, and C. diff, eargloves and a gown upon entry into the patient's room. Make sure you clean all used equipment and surfaces with EPA-approved disinfectants after use. Droplet precautions. For pathogens like influenza, COVID-19, and RSV, wear a surgical mask and maintain a distance of 6 feet or more when possible. Airborne precautions. For patients with TB, measles, or varicella, you are required to wear a N95 respirator and work in an AIIR, or Airborne Infection Isolation Room. You can only enter the AIIR after you've received fit testing and facility clearance. As a critical reminder, if you're unsure about a protocol, stop and consult the charge nurse or infection control officer.
Personal protective equipment. PPE protocols. Putting on or donning and taking off or doffing of personal protective equipment is essential to prevent cross-contamination. PPE donning order. First, put on your gown, then your mask or respirator, followed by your goggles or face shield, and finally, your gloves. PPE doffing order. When you are finished seeing the patient, first take off your gloves, then your goggles or face shield, followed by your gown, and finally, your mask. Remember to wash or clean your hands thoroughly after removing each item, especially your gloves and gown, as they are the most vulnerable to contact.
Clinical judgment and final safety reminders. As on-site healthcare professionals, your clinical judgment and observations are key components of infection control. Here is a final list of important reminders. Always adhere to facility-specific policies. We are working in their home and space. Be prepared. Ensure your supplies are clean and stocked. Help those around you. escalate any concerns to facility staff. This could be spills, lack of signage, or noticeable and previously recognized symptoms in staff or patients. Lastly, do not report to work if symptomatic. If you are feeling ill, please reach out to your MedElite supervisor and give ample time for us to alert the facility and make necessary adjustments. Again, if you ever are confused about facility protocols, ask the nursing supervisor or infection preventionist. Transparency and teamwork are so important to ensure the best patient outcomes.
From all of us at MedElite, thank you for your commitment to safety and clinical excellence. Your careful adherence to all infection control policies upholds our mission to provide the highest quality care.